Hi, my name is Nadia Lopez. This assignment is Medical English, and today I'm going to talk about hyperkalemia after missed hemodialysis. First, a definition. What is hyperkalemia? Hyperkalemia is an elevated level of potassium in the blood. Normal potassium levels are between 3.5 and 5 milliequivalent per liter. Hyperkalemia can cause an abnormal heart rhythm, which can result in cardiac arrest and death. Here is a video of hyperkalemia and ECG.
We have 1 critical minute to focus on the ECG changes in hyperkalemia. Let's go. The first changes that occur as potassium levels rise are the peaking of T waves. Next, the amplitude of the P wave decreases and the PQ interval increases. The QRS widens severely. As potassium increases further, the shape of the QRS segment and the T wave become more sine-like. This is highly associated with ventricular fibrillation and with that cardiac arrest. If you have a patient with hyperkalemia that has a wide QRS segment, keep them on the monitor at all times. For more information on hyperkalemia, including treatment, watch my video on it. You are dismissed.
And what is hemodialysis? Hemodialysis is a treatment to filter wastes and water from your blood, as your kidneys did when they were healthy. Hemodialysis helps control blood pressure and balance important minerals, such as potassium, sodium, and calcium in your blood. Hemodialysis can help you feel better and live longer, but it's not a cure for kidney failure. And here is a video of what is hemodialysis and how it works.
Hemodialysis is a medical procedure. It's one of the ways you can treat severe kidney disease. The way hemodialysis works is that it uses an artificial kidney to replace some of the functions of a healthy kidney.
Blood is taken out of the body, goes through the dialysis machine, goes through the filter, is cleaned, and then it comes back. So you don't really lose any blood. It all goes through the dialysis machine.
So it's really that artificial kidney and the blood working together to clean the fluid in my body. You're taking that urea out of the blood, you're taking potassium out, the different things you want to balance out of the blood. So then it's like a magnet, and it'll draw those solutes out. Amazing process. You think it has to get to the cells all through your body, goes to your head. Each one of those cells has fluid in it that needs to be cleaned. Everything you normally would get rid of urination, you're trying to get rid of the hemodialysis.
And when people dialyze, sometimes if they do conventional dialysis where they're dialyzing 3 times a week, they may feel sort of tired after they have dialysis. After a while, they feel better. People who do more intensive dialysis or daily dialysis at home, they feel like they can do things right away.
It isn't that you're living to dialyze. You're going to dialyze and go out and live the life you're meant to live.
Okay, now we have applications in medicine. Here we have a clinical case. A 48-year-old man with a history of end-stage renal disease who had undergone parathyroidectomy presented to the emergency department with weakness and diffuse muscle aches after missing a hemodialysis session. The laboratory analysis showed severe hyperkalemia. This means a potassium level in 36 milligrams per deciliter. The patient underwent emergency hemodialysis, which resulted in a marked improvement in the electrolyte balance. And now we have, the patient had a posterior surgery. Then he missed hemodialysis, which caused him hyperkalemia. but when the emergency hemodialysis were done, the patient present normal potassium levels. How a renal dialysis works.
You need your kidneys to live. It's obviously very important. Unfortunately, some people lose their kidney function either due to chronic illnesses. It's a common form of chronic kidney disease in America is diabetic kidney disease. In addition to that, people lose their kidney function acutely, suddenly, due to a catastrophic illness or some intermittent reversible illness. When that happens, people need acute dialysis as a life-saving treatment to allow them to have a reversal of their acute medical problems and survive. The dialysis is typically done either in an intensive care unit or care at an inpatient dialysis clinic, even a hospital. Often dialysis is a bridge to transplantation, and people on dialysis are often on the kidney transplant waiting list, and hopefully at one point in the future will get a kidney transplant either from a family member or a loved one, alternatively through the deceased donor kidney waiting list. Dialysis is done typically two different ways. The most common way it's done is a treatment called hemodialysis. Hemo refers to blood. So in this treatment, blood is removed from the body, treated through a dialysis kidney filter, and then returned back to the body. People on this treatment can have a normal daily lifestyle. They're able to participate in their normal daily family activities. A lot of people on this treatment can go to work on a regular basis and are able to have a good quality of life. The second form of dialysis is called peritoneal dialysis. So peritoneal dialysis that allows people to do the dialysis treatments in their own home. Treatment involves using your own body, using the peritoneal cavity to do the dialysis. Fluid in the peritoneal membrane can be exchanged to remove kidney poisons and extra fluid, and therefore allows the individual to replace their kidney function and restores them to good health, normal daily activity.
Okay, well now we have the pros and the cons. Pros. The patient improved his potassium levels, calcium levels, sodium and vitamin D levels by performing an emergency hemodialysis. Also, the T waves on the electrocardiogram, although the QT segment remained prolonged. Cons. Hyperkalemia causes acute or T abnormal waves in the EC. It also can cause palpitation, muscle aches, pain, weakness, and numbness. A missed hemodialysis causes abnormal electrolyte levels and also can lead to a patient death. Now we have the issue applied in Ecuador. In Ecuador, patients with renal disease and insufficiency have a life expectancy of 5 to 15 years in Ecuador. So a patient with renal insufficiency and renal disease have two ways. Hemodialysis, which the 90% of the patients, they perform these techniques, or peritoneal dialysis, but just a 10% of the population does this. Now, the treatment with hemodialysis costs $1,456 and it has to be done 3 times per week. It's a really expensive procedure in Ecuador. And finally, we have the conclusion. We have that in conclusion, hemodialysis in renal patients can improve hyperkalemia and other electrolyte abnormal ranges. However, a missed hemodialysis can lead to elevated QT or T waves, muscle aches, and other electrolytes abnormalities. That's why it's important to have control in hemodialysis treatment. Thank you.